Hello my dear future nursing officers, welcome back to my channel. Today we will discuss about sense organs. In the sense organs we will discuss about ear. Without wasting your time, let's start first question. The organ which is responsible for the body balance is option A, eye, option B, ear, option C, mouth, option D, tongue. Correct answer. Option B, ear is the responsible for the body balance. Next question. Which part's function is transmission of sound vibrations to the internal ear? Option A, vestibule, option B, tympanic membrane, option C, auricle, option D, Eustachian tube. Correct answer. Option B, tympanic membrane is correct answer. Move to next question. The part of the ear which is responsible for maintaining balance of the body. Option A, semilunar canals. Option B, cochlea. Option C, tympanic membrane. Option D, ossicles. Correct answer. Option A, semilunar canals. Next question. The three auditory ossicle structures present in the ear are option A, pinna, auditory canal and tympanic canal. Option B, utricle, saccule and semicircular canal. Option C, malleus, incus, stapes. And option D, scala vestibuli, scala media and scala. Correct answer. Option C, malleus, incus and stapes. Move to the next question. Most of the infections spread to the ear from throat through option A, Eustachian tube, option B, cochlea, option C, ear canal, option D, tympanic membranes. Correct answer. Option A, Eustachian tube is correct answer. So, Eustachian tube, or we can call another name of auditory tube or otopharyngeal tube also. It is 4 centimeters long, extending from middle ear to nasopharynx. So, occlusion of the tube leads to the development of otitis media. Mostly we can see in children's. Next, move to MCQ. Many children with tonsillitis develop ear infection. This is because the ear and throat are connected by the option A, larynx, option B, Eustachian tube, option C, epiglottitis, option D, esophagus. Correct answer. Option B, Eustachian tube. Next question. Wax-like substance secreted by glands in the external ear canal is option A, blanc, option B, cerumen, option C, collagen, option D, lipid. Correct answer. Option B, cerumen is wax-like substance secreted from the glands. Next, the audible range of human ear is between option A, 20 to 20,000 Hz, option B, 200 to 20,000, option C, 20 to 2000 Hz, option D, 50 to 5000. Correct answer. Option A, 20 to 20,000 Hz is normal range of ear audible. Next, what is the physiological response of the ear to the intensity of sound? Option A, transmission. Option B, loudness. Option C, inertia. Option D, energy. Correct answer. Option B, loudness is correct answer. Move to next MCQ. The number of complete oscillations per unit time is called the option A, time period. Option B, amplitude. Option C, frequency. Option D, wavelength. Correct answer. Option C, frequency is correct answer. Next question. Loudness or softness of a sound is basically determined by its option A, amplitude. Option B, oscillation. Option C, time period. Option D, phase. Correct answer. Option A, amplitude. Amplitude means the maximum extent of vibration measured from the position of equilibrium. Move to next question. Decibel is a unit for measuring which of the following? Option A, water level. Option B, heat level. Option C, salinity level. Option D, sound level. Correct answer. Option C, salinity level is decibel measuring unit. Decibel, it is a unit of sound, is a unit for expressing the pressure or power and thus degree of intensity, loudness of sound. Move to next question. Profound hearing loss is described as greater than option A, 20 decibels. Option B, 80 decibels. Option C, 40 decibels. Option D, 60 decibels. Correct answer. Option B, 80 decibels. There are 4 types of hearing loss: mild, moderate, severe and profound hearing loss. So, mild means less than 20 decibels, moderate means 20 to 40 decibels and severe hearing loss means 40 to 60 decibels and profound more than 80 decibels. Now, let us go to next MCQ. Expose you to noise above which of the following decibel level causes permanent hearing loss? Correct answer. Option B, more than 90 decibels is correct answer. Next question. Equipment used in examination of ear is option A, laryngoscope. Option B, ophthalmoscope. Option C, otoscope. Option D, proctoscope. Correct answer. Option C, otoscope is correct answer. So, laryngoscope we will use for visualization of the vocal cords and for placement of the ETT intubation, so into the trachea under direct vision. Next, ophthalmoscope. Ophthalmoscope is used to detect, evaluate symptoms of retinal detachment or any eye diseases like glaucoma. Next, proctoscope. Proctoscope we will use for detailed examination of the rectum. So, it is a straight metal or plastic tube with light and lens also. My dear nursing officers, this is the otoscope picture. It is a help for visualize the examine the condition of the ear canal and eardrum. Move to next question. Infection of middle ear is called option A sinusitis, option B mastoiditis, option C otitis media, option D labyrinthitis. Correct answer option C otitis media is infection of middle ear. Next, sinusitis means inflammation of the lining of sinuses in the face. This inflammation caused by virus, it will resolve about 10 days. So, no need to antibiotics. Next, mastoiditis. Mastoiditis means it is a inflammation in middle ear infection. So, this infection can result damage the mastoid bone and formation of the pus filled cyst around the mastoid bone. Next, labyrinthitis. Labyrinthitis means inflammation of the inner ear. So, brain nerves connects from the inner ear. Next question. The client comes to the clinic and is diagnosed with otitis media. Which intervention should the clinic nurse include in the discharge teaching? Option A. Instruct the client not to take any over the counter pain medication. Option B. Encourage the client to apply cold packs to the affected ear. Option C. Tell the client to call the healthcare provider if an abrupt relief of ear pain occurs. Option D. Wear a protective ear plug in affected ear. Correct answer. Option B. Encourage the client to apply cold packs to the affected ear. Next, one of the complications of chronic otitis media is option A. Acute and chronic mastoiditis. Option B. Irreversible hearing loss. Option C. Infection. Option D. Internal injury. Correct answer. Option A. Acute and chronic mastoiditis. So, inflammation of the mastoid sinuses usually as a result of the spread of infection from chronic otitis media called mastoiditis. Next, mastoid sinuses are air filled space into mastoid process of temporal bone, and mastoid process is portion of temporal bone extending downward and forward behind the external auditory meatus. Move to next MCQ. What is the intervention for acute serous otitis media? Option A. Mastoidectomy. Option B. Maryngotomy. Option C. Stapedectomy. Option D. Tympanoplasty. Correct answer. Option B. Maryngotomy is the correct answer. Maryngotomy means it is a procedure to create a hole in the eardrum to allow fluid that is in the middle ear to drain out. అంటే మనకి ఈ ఒక హోల్ లాంటిది ఇయర్ డ్రమ్ దగ్గర క్రియేట్ చేసి అక్కడ ఫ్లూయిడ్ ఫిల్ అయి ఉంటుంది కదా, ఫ్లూయిడ్ ఆర్ బ్లడ్ ఆర్ పస్ ఎనీథింగ్. సో దాన్ని మనము ఒక స్మాల్ ట్యూబ్ని ఇన్సర్ట్ చేసి అక్కడ ఫిల్ అయినటువంటి పస్ ఆర్ బ్లడ్ ఫ్లూయిడ్ని మనము డ్రైన్ అవుట్ చేయడాన్ని మ్యారింగోటమీ అంటాము. నెక్స్ట్ మూవ్ టు నెక్స్ట్ క్వశ్చన్. మోస్ట్ కామన్ కాజ్ ఆఫ్ అక్యూట్ ఓటైటిస్ మీడియా. ఆప్షన్ ఏ ఇమోఫీలియస్ ఇన్ఫ్లుయెంజా, ఆప్షన్ బి స్టెఫైలోకోకస్ నిమోనియా, ఆప్షన్ సి స్టెఫైలోకోకస్ ఆరియస్, ఆప్షన్ డి సూడోమోనాస్. కరెక్ట్ ఆన్సర్ ఆప్షన్ బి స్టెఫైలోకోకస్ నిమోనియా. నెక్స్ట్ క్వశ్చన్. The client is diagnosed with acute otitis media. Which sign and symptoms support this medical diagnosis? Option A unilateral pain in the ear, option B green foul smelling discharge, option C sensation of congestion in the ear, option D reports of hearing loss. Correct answer option A unilateral pain in the ear. Now we will see sign and symptoms of otitis media. Sign and symptoms of acute otitis media are pain in the ear and drainage of fluid from the ear canal and ear tugging and hearing loss. Next, systemic signs include fever, irritability, headache, lethargy, anorexia and vomiting. We will see in acute otitis media. Next, for the patient with otitis media, nursing care is centered on reducing the severity or alleviating problems. Option A dizziness and decreased hearing, option B fever and tinnitus, option C pain and pressure in the ear, option D nausea and vomiting. Correct answer option C pain and pressure in the ear is correct answer. Move to next MCQ. If palpating the tragus or auricle causes pain, the problem is option A otitis externa, option B otitis media, option C pharyngitis, option D sinusitis. Correct answer option A otitis externa is the correct answer. Next question. Which among the following is also called otitis externa? Option A occipital bone osteomyelitis, option B frontal bone osteomyelitis, option C temporal bone osteomyelitis, option D parietal bone osteomyelitis. Correct answer option C temporal bone osteomyelitis is correct. Next question. Which of the following symptoms would the nurse expect to find when assessing a client with Mhsrb disease? Option A epistaxis, option B facial pain, option C ptosis, option D tinnitus. Correct answer option D tinnitus. Tinnitus means ringing in the ear canal, and epistaxis means nose bleeding, we will call epistaxis, and ptosis meaning drooling of the eyelids. Next question. Accumulation of endolymph causing distension and increased pressure within membranous labyrinth with destruction of sensory cells in the ampulla and cochlea is option A Mhsrb disease, option B otitis media. Option C, osteosclerosis. Option D, hordeolum. Correct answer. Option A, Meniere disease is correct answer. Move to next question. Condition of the inner ear characterized by episodic vertigo, tinnitus and sensory neural hearing loss is referred to as. Option A, otitis media. Option B, Meniere's disease. Option C, otosclerosis. Option D, nystagmus. Correct answer. Option B, Meniere's disease. And nystagmus means involuntary eye movement which may cause the eye rapidly move from side to side, up and down. So, may slightly blur vision also is there in nystagmus condition. Now, we will see next MCQ. Vertigo is due to problem in option A, external ear. Option B, inner ear. Option C, middle ear. Option D, tympanic membrane. Nursing officers, here some typing error is there. Please correct it. It is not cur, here. Correct answer. Option B, inner ear. Vertigo is a problem of inner ear. Next question. What drugs are given to the client with Meniere's disease? Option A, antihypertensive. Option B, diuretic. Option C, antibiotic. Option D, vasoconstrictor. Correct answer. Option B, diuretic is correct answer. Management of Meniere's disease. In acute attack are bed rest, antihistamines and vasodilators, example nicotine acid, and sedatives, example diazepam, and discontinuation of smoking, avoid watching TV, low salt diet. So, less than 2 grams per day and diuretics we will use in drug of choice for the Meniere's disease. Move to next question. Drugs used in relieving symptoms of Meniere's disease include all except option A, antiemetics. Option B, diuretics. Option C, atropine. Option D, diazepam. Correct answer. Option C, atropine is correct answer. Next question. While communicating with a hearing impaired patient, option A, face the patient when speaking. Option B, repeat the statement. Option C, shout so that the patient can hear. Option D, use high pitched voice. Correct answer. Option A, face the patient when speaking is a correct way to communicate the hearing impaired patient. Face the patient when speaking to hearing impaired patient to facilitate the communication. Talk to person in normal volume and lower pitch because shouting is not helpful and higher frequency are less easily heard. Move to next question. Nurse is caring for a client who has impaired hearing. Which of the following approaches will facilitate communications? Option A, speak frequently. Option B, speak loudly. Option C, speak directly into the impaired ear. Option D, speak in a normal tone. Correct answer. Option D. Speak in a normal tone. Move to next MCQ. While instilling ear drops, the ear canal of an adult is straightened by pulling pinna. Option A. Down and back. Option B. Up and back. Option C. Straight down. Option D. Straight back. Correct answer. Option B. Up and back. Now, pull pinna up and back in adults and down and back into children below 3 years of age. Instilling drug into ear. Never instill the drop directly on the eardrum. So, instill the drug into side lateral position at room temperature, not ice cold use. Now, we will see slides. Here down and back. This we will use in children below 3 years of age. And we will see next slide. Up and back. This one we will use in adult age. Move to next MCQ. Which referral would be most important for the client with permanent hearing loss? Option A. Oral rehabilitation. Option B. Speech therapist. Option C. Social worker. Option D. Vocational rehabilitation. Correct answer. Option A. Oral rehabilitation is correct answer. Next question. In Weber's test, lateralization of sound to disease ear indicates. Option A. Conductive deafness. Option B. Combination of both sensory neural deafness and conductive deafness. Option C. Sensory neural deafness. Option D. Tympanic deafness. Correct answer. Option A. Conductive deafness. There are two types of test we will use for lateralization of the sound. So, first one is Weber's test. In this test, we will see conductive deafness, and second one is Rin's test. In this test, we will check combination of both sensory neural deafness and conductive deafness. We will see in this Rin's test. Weber's test is a test used for unilateral conductive type deafness. Vibrating tuning forces held against the midline of the top of the head. The persons with unilateral conductive type deafness, sound will be perceived as being more pronounced on the disease side. In persons with unilateral nerve type deafness, sound will be perceived as being louder in good ear. Now we will move to next MCQ. Which commonest fungi cause otomycosis? Option A. Mhsrb. Option B. Aspergillus. Option C. Rhizopus. Option D. Candida. Correct answer. Option B. Aspergillus is correct answer. Infection of external auditory matters of the ear caused by fungus, mainly Aspergillus and Candidas, so called otomycosis. Now we will see next MCQ. Mechanical or electrical device that improves hearing. Option A. Lip reading. Option B. Speech therapy. Option C. Sign language. Option D. Hearing aids. Correct answer. Option D. Hearing aid is mechanical device that improves the hearing. Next, Kaiser Fleischer means golden brown ring at the limbus of cornea seen with a hand lens is observed in option A, Down syndrome, option B, cataract, option C, glaucoma, option D, Wilson's disease. Correct answer. Option D, Wilson's disease is correct answer. Wilson's disease is a hereditary syndrome transmitted as an autosomal recessive trait. In this, decrease of ceruloplasmin permits accumulation of copper in various organs like brain, liver, kidney and cornea with increased intestinal absorption of copper. Pigmented ring at the outer margin of the cornea is pathognomic indicative of a disease. Move to next MCQ. Which one of the following procedure is used to correct otosclerosis? Option A, laryngoplasty, option B, stapledectomy, option C, mastoidectomy, option D, laryngotomy. Correct answer. Option B, stapledectomy is correct answer. Otosclerosis is a chronic progressive deafness of low tones caused by the formation of spongy bone especially around the oval window with resulting ankylosis of the stapes. Surgical procedure is example, stapledectomy is used. Okay, my dear future nursing officers, today's session is completed. So, hope you all are like this video. If you have any doubts and queries about this session, please let me know in comment box and don't forget to do subscribe, like, share and click the bell icon. Okay, my dear future nursing officers, we will meet you tomorrow with new session and new topic. So, until then, don't forget to subscribe to my channel. Please like, share and click the bell icon. Thank you.